Welcome to Pharmacy Practice News Meeting Highlights, our new convention coverage program. We're here at the 2017 ASHP Midyear Clinical Meeting in Orlando to bring you the latest research and reports from today's professional poster session. For more information, log on to www.pharmacypracticenews.com. Shimeng, thank you so much for joining us on Meeting Highlights today.
Hi, thank you for your interest.
Can you just introduce yourself a little bit and give us what your background is and how you ended up working on this interesting project?
Okay, sure. My name is Shimeng Liu. I'm a pharmacist at AtlantiCare Regional Medical Center in New Jersey. So in June 2016, we implemented a new opioid-free pain protocol called ALTO in our emergency department. And the purpose of the protocol was to reduce the use of opioids as first-line agents, as well as increase the awareness about the importance of appropriate opioid prescribing. So, and now we did a retrospective study to looking at the impact of this protocol implementation on opioid use in our ED.
And did you focus on particular indications?
Yes, the ALTO protocol targets 5 indications. They're musculoskeletal pain, acute and chronic lower back pain, extremity fracture or joint dislocation, renal colic, and migraine headache. And the protocol consists of various non-opioid medications, ranging from as simple as acetaminophen to some novel uses of medications such as IV ketamine infusion for lower back pain or IV lidocaine for renal colic. And then we educated them on the use of the protocol itself, like how to order it, how to dispense it, how to administer it, and any monitoring parameters associated with it. And we also educated them on the importance of the opioid epidemic.
So you had a 9 months before and then 9 months post the intervention?
And we have seen a significant decrease in the opioid use in these patients from 41.5% to 32.1%. That came out to be about a 9.3% decrease, and this was equivalent to treating 487 less patients with opioids in a 9-month period when these patients would have been received an opioid before.
And how did that affect their time spent in the emergency department and costs?
Yeah, so we looked at some secondary endpoints, include pain score reduction, ED length of stay, and ED cost per patient. And what we found is there's no clinically significant difference in these parameters after the protocol implementation. However, we also looked at the ED CAPS survey scores as well. Unfortunately, we did see some decrease in the pain-related ED CAPS scores in these patients, and this is definitely could be a potential area for improvement. However, if we can decrease opioid use and prevent more patients from becoming addicted in the long run, then this is a trade-off that we are willing to take. And then lastly, among the patients who are actually were treated using the order set, we looked at the protocol effectiveness. It came out to be about 77%, which means that 77% of the order set treated patients responded well to ALTO medications, while the other 23% of patients required additional opioid therapy for optimal pain control.
Was one of the indications more successful than the others?
Yes. So this graph is a breakdown of the indications.
Okay.
So we've seen most decrease in opioid use in musculoskeletal pain and chronic back pain, and the least decrease use we're seeing in renal colic.
So what's your next step after this? Are you going to try to study in other indications or continue your protocol system?
Definitely. So we've seen a great success with our protocol, and then we are thinking of further expanding the protocol, potentially moving this to inpatient treatment as well, or expanding the number of indications we can use these medications in. And then we are also looking to do more studies, maybe looking at the number of discharge prescriptions that patients get that are opioid, and if there's a decrease in the discharge opioid prescriptions in these patients as well.
Any other final messages for our viewers about what you feel were the most important findings of your study?
We really have seen a shift in the treatment modalities of these patients, where the prescribers are really going for non-opioids first line, and then only using opioids in patients who really need them.
Thank you very much. That's been a very valuable lesson for pharmacists out there to hear and to see that they can make an impact on certain diagnoses. Thank you very much for joining us on Meeting Highlights. For Pharmacy Practice News and Meeting Highlights, I'm Dr. Linda Bernstein.